We welcome reference by the Secretariat to the UN high-level panel's recommendations and the initiative to map WHO's activities in relation to some of these recommendations in annex to the report. However, the issue of delinking the cost of research and development from the end prices of health technologies has not been adequately addressed, and there is a mere mention of a code of principles being under consideration. The report also includes key considerations prioritized in terms of impact, complexity, and cost. However, we believe a clear vision on access to medicines and vaccines should not just discuss the harvest potentially low-hanging fruits, but boldly implement strategies and approaches with the highest impact and harness needed resources as a second step. The recommendations of the UN high-level panel constitute a holistic approach and correctly identify the problem of access to medicine as a problem of both high-income countries and low and middle-income countries. Further, paragraph 8 mentions the issue of transparency in the research and development process. This item, it is argued, it involves greater complexity and additional resources. Rather, increased transparency in areas like clinical trials require political will and WHO's norm-setting capabilities and should therefore be addressed as soon as possible. We urge WHO to align its activities with the recommendations of the UN high-level panel and formalize implementation of its recommendations by setting up a strategy and action plan. We urge WHO to take bold and visionary steps to delink the cost of research and development from the end prices of health technologies. We further urge WHO to consider a global convention on research and development as suggested by the UN high-level panel. We cannot afford to delay action on this agenda and any further. Millions of lives are at stake. I thank you.